Welcome back. February is American Heart Month, a time for Americans to focus on their heart health and learn about the several types of conditions associated with the disease. So tonight we're joined by Dr. Vic Graywall from Cooley Dickinson Hospital, a cardiologist based out of Northampton, and we thank you so much for being here.
Yeah, no problem. Thanks for having me.
So I just want to ask you, what are some of the major risk factors for heart disease?
Yeah, so when we talk about heart disease, we're talking about coronary artery disease, which is the most common form of heart disease in the U.S. and really worldwide. And you want to talk about the risk factors for building plaque in your blood vessels, which are high blood pressure, high cholesterol, smoking, and your family history, so your genetics. Diabetes is another big one, and these are all things that you can check regularly with your primary care doctor, and if you have a cardiologist, those are things you should be keeping an eye on.
Yeah, and something else to keep in mind is keeping a healthy weight, right? So obesity, being overweight, can that increase your risk for heart problems?
Yeah, so obesity is part of that risk sort of profile. You know, if you're obese, you're more likely to have diabetes and high blood pressure and high cholesterol. So losing weight is one of the easiest ways to treat all of those risk factors and get them under better control.
And what would you suggest as some of the ways to, go about weight loss?
Yeah, so there's a lot of different fad diets out there and things like that that people have had success with. The problem is finding something that gives you sustained success, that helps you keep the weight off over time. I talk to my patients about intermittent fasting. I recommend everybody, take a look at it and see if it's right for you. Talk to your doctor before you start anything like that, but it has been effective for a lot of people.
All right, and when people think about heart risk for heart disease, many people think about heart attacks, but stroke also a major risk factor. So tell us exactly, what is a stroke?
Yeah, so a stroke, just like a heart attack, is a blockage in one of the blood vessels to the heart muscle. A stroke is a blockage in the blood vessels that go to the brain tissue. So they're caused by the same things, atherosclerosis. All the risk factors we talked about before kind of apply to the same thing if you want to reduce your risk of stroke.
Yeah. All right. Dr. Graywall, we thank you so much for joining us and providing that insightful information this American Heart Month. Thank you.
Sure thing. Thanks.